Hi, I'm Brenda. Welcome to Cascade Summit Animal Hospital. We're going to go ahead and give you an interactive tour of our hospital today. So as you walk in, you're going to see our lobby here, and usually you're going to go ahead and run into Tiffany. She manages our front desk, and she'll get you all checked in, and we'll go ahead and get you right into a room. So if you follow me, I'll show you here. We've got 3 exam rooms. 2 of our exam rooms have hydraulic lift tables that are also scales, and so this way the dogs are able to get on the table and then be lifted up into the air rather than us picking them up and putting them on a high surface, which can be kind of scary. After the exam, we also go ahead and check you out in the room. We've got a mobile credit card machine, and we get you all checked out, so this way it's a seamless process and you can head right on out the door from there. So continue following us on through the hospital, and we'll see you when we're done.
Hey everybody, this is Dr. Shadagray, and this is Mab. We're going to talk about acupuncture a little bit. And Mab's got her acupuncture needles in. You can see the little copper metal against the black of her fur. And the needles are really fine. They're only about 0.2 millimeters in diameter, so it's pretty pain-free going in. At most they might react like a little flea bite, but most of the time they don't even react to needle insertion. So it's really nice for them. It generally tends to calm them quite a bit. On occasion, some dogs will even fall asleep, although that's rare. And the needles only stay in for anywhere from 10 to 30 minutes, depending on what we're treating and how they're responding to their needles. So it's a very easy thing to do for them, very well tolerated, and depending on what we're working with, initially they might need treatments once a week or once every couple of weeks, and then as they improve, we back off on the frequency of treatments. And what really helps in addition to acupuncture is doing Chinese herbs at the same time, because that helps to advance the benefit of the needles in between acupuncture sessions. So it's really good, and she likes her herbs mixed in with some dog food and occasional turkey lunch meat. So this is Mab getting her acupuncture.
Susan. I'm a technician here at Cascade Summit Animal Hospital, and I'm going to take you on a tour of our treatment area. So let's start with our kennels. When you drop your pet off with us during the day, we'll give them a blanket and a drink of water. They have a nice soft spot to sit. The nice thing about these kennels is that we can turn them on. So when we're recovering pets from an anesthetic procedure, we can turn the kennel on, get the bottom floor of the kennel nice and toasty, and put them in there. As they recover, they're still staying nice and warm and comfortable. Over here we have our instrument sanitizing and cleaning. This is part of our lab place. We have a centrifuge where we spin down our blood serums. And then we've got Dawn over here on the microscope reading I think it's a fecal slide. Over here we have in-house lab testing that we can run. We do tend to send a lot of our stuff off to the reference lab, but if your pet is sick or injured and we need quick results, we can run them right here in the clinic. I think that's it.
This is our group office where the doctors and technicians can come and work on their records. We are paperless, and so we have a lot of computers around here, but it's really nice. We can access our patients' records from any room in the hospital, even from our homes. When the doctors are at home, we can log in and access all the records. This is Susan. She does all of our inventory, so if you make any special orders for food or medications, you'll be talking to her. This is our surgery suite, and you can see Dr. Chamberlain here is performing a spay on a cat, and we have our nurse monitoring anesthesia and getting anything Dr. Chamberlain needs. We have a very nice surgical monitor that tells us everything going on with a patient at every moment, and we have a lot of warming devices to keep our patient nice and cozy. We have a hot air blanket on top of the patient and a warm water blanket under the patient. And we also have down there an IV fluid warmer. Every patient is going to be on IV fluids. You can see the pump right there, making sure their blood pressure stays normal and keeping their kidneys nice and hydrated during the procedure.
So this is Tippy, and she's recovering from her spay procedure today. One of our staff members will sit with the patients as they're recovering until they're fully awake and sternal. She's wrapped up in her little towel, and she's got her fluids still connected and her cage heat on. So we'll just sit with her for a bit while she's waking up.
I'm Dr. Ortner, and we're going to show you a little bit of what happens during a dental procedure. So our patient here is under general anesthesia. We have a nurse monitoring anesthesia. There's our surgical monitor showing us everything that's going on with our patient at all times. We have an IV fluid setup going, and that fluid is going through a fluid warmer into the patient through an IV catheter here in the leg. And to keep our patient nice and cozy, we have this blue warm water circulating blanket beneath the patient and a hot air inflated blanket on top of the patient. We have a dental x-ray unit, and we have completed this patient's cleaning and all the dental x-rays. And after the cleaning, the oral exam, and the x-ray evaluation, what we have found is this dog has a very sick tooth that is going to need extraction. So in the mouth, we have the very large molar. The tooth behind that, the second molar on this patient, is the diseased tooth that we will be extracting today. So when you look at the x-ray here, you can see here's our large tooth, and the one behind it, the second molar. The back root looks pretty good, but this forward root has a lot of bone loss from serious infection, and the bone loss is significant enough that this tooth cannot be saved even with cleaning. So we're going to go ahead and extract that tooth so that this can heal, and that way we save our very important big molar. So during the extraction, we'll be using all of these instruments, and our patient has received a local numbing injection, so this whole area will be numb so we can keep our anesthesia level fairly low. And that way when he wakes up, he won't have any discomfort because he will be numb for that area for about 8 hours. And when that wears off, he will be getting some significant pain medicine at home so that he'll be comfortable, and some antibiotics to help that infection heal. And that's all there is to it.
Okay, so we're in our X-ray, our radiology area of the hospital, and I'm going to kind of take you on a little tour about our machine and how we take X-rays and what we do with them. So I'm going to kind of walk you through a case of a little kitty cat that I think was vomiting and not eating well, and she was painful. And there was some potential that she might have been playing with a sewing needle and some string. So we recommended taking some x-rays. Sewing needles, many of them are composed of metal, so that's something that might show up well on an x-ray. So what we do, this is going to be our little sample patient. But what we do is we take our patient, and we have some tools to help make them be more comfortable. This is something that's called a V-tray. So when we take the x-ray with the patient on their back, they just kind of lay like this, okay? And we actually measure patients so that we can have the appropriate settings for the radiographs on them. And we use this little tool right here to find out how thick they are and how wide they are. And we punch in the appropriate setting in here. And there is this little special light that I can focus on the area of interest. And then when our technicians take x-rays, they're trained to do that, and they wear some protective gear to protect their thyroid and shield their body and their hands from the x-ray. And then this is an example of one of the images that we bring up. And this is this little kitty cat face that I was talking about. And she's laying on her side, and I think it's important to remember that x-rays are a relatively non-invasive diagnostic. I think they're very easy to do, and they're not stressful for the patient. It's just kind of laying them on their side or laying them on their back. But this is the needle that's in this kitty cat, and I ended up taking her to surgery, and it's behind her stomach, and it was actually in some of her intestines. But this little kitty cat, she's doing great after surgery. She has no more sewing needles to play with, and she's doing wonderfully at home.
Hey everybody, Dr. Shattergray again, and I'm going to show you my naturopathic pharmacy. So this cabinet here, we've got what we call nutraceuticals, which are nutritional supplements that are designed to help treat specific disease conditions. So things like glucosamine and chondroitin for joint problems, things like coenzyme Q10 and hawthorn for heart problems. So these are all ingredients that are all combined to treat a specific condition. And these particular ones are nice because they come in chicken liver flavored tablets, so they're pretty tasty. And the next cabinet, we have Chinese herbs. And these are all different formulas that work with the body from a traditional Chinese medical perspective. And these are all powders, but they also can come in capsules or tablets. And the powders generally we mix in some canned food for the dogs, and some of the cats will eat it that way too. The next cabinet is homeopathy. And these are little tiny homeopathic pellets. And homeopathy is another branch of alternative medicine. We have descriptions for all of the different types of medications on the website under Holistic Care. And then lastly, we have liquids. And these are much easier to dose for kitties because the liquids you can just squirt into the mouth. And we have some Western herbal liquids and some Chinese herbal liquids. And then on the top we have some tablets that are what we call glandulars, and these are made from healthy tissues from cattle or sheep or pigs to supplement the unhealthy tissue of the patient. So if I have a kitty with kidney disease, we can do a kidney glandular, and it really helps to give their body the building blocks to rebuild those tissues. And these are usually pretty tasty because there's beef products and pork products in them. And then we have some digestive enzymes and probiotics, which probiotics are really good if you have a patient on antibiotics. And we have some herbal ear cleansers and an herbal eye wash and an herbal skin spray for skin irritation. So that's the naturopathic pharmacy.
Hi, I'm German Kids. Welcome to my home away from home. My wonderful kids. Lucy just got a bath. My little kids are waiting. And Kobach just got done too. This is Kelly. She comes in every week. Then we got my lovely assistant Caroline. Hello. And this is Angelo. He's also been
bad.
Yep. This is us. Come see us.